thank you everyone for joining us for today's May 19th COVID-19 briefing. We are going to talk about the status of the virus in Chittenden County and Burlington. And we also have an announcement that will be at the end of the presentation. We'll be announcing my appointment for the next CETO director. So I'm going to dive right in. After that, we will take questions. So you will see in today's discussion that while our emergency response continues, and we are committed to that for weeks to come and likely months to come here still, we are seeing some very significant, very positive indicators of diminishing risk of new disease across the community. I'd like to start with some particularly good news. Today, the state of Vermont reports that Chittenden County has become the highest vaccinated county within the state. The greatest percentage of our population is vaccinated of any Vermont county. And given that Vermont is leading the national efforts, is literally the top state in terms of overall vaccinations, this makes Chittenden County the highest vaccinated county and the highest vaccinated state in the nation. This is certainly thanks to the work of state partners, community leaders, schools, the residents of Burlington and Chittenden County, and the city team has certainly played a role in it as well. And we will talk a little bit more later in the briefing about how we're going to continue that in this coordinated multi-partner way. But first, I'd like to welcome back to the briefing once again, Dr. Stephen Loeffler, the President and Chief Operating Officer of the UVM Medical Center, and someone who basically every couple of weeks throughout this pandemic, we have looked at the data together, and that's where we'd like to start this briefing. We have up here a slide that shows vaccination rates, and there you can see the kind of representation of what I just said. Chittenden is now number one with 74.8% of the people 12 and older having at least one dose of the vaccine. And that's despite the fact that we've just started with the over 12 to 15 population has only been open, I believe, since last Friday or Saturday, that people were able to, in that range, were able to start getting injections. And only 13.5% of that population has one dose as of the most recent check. Note that 74.3% of the 16 to 17-year-olds are vaccinated. I want to thank the BHS and the school district for that. And I think it gives me hope that the 12 to 15-year-olds are going to catch up soon. 18 to 35 continues to be the area, 18 to 20 continues to be the area where we really have the most work to do. And we're working on some strategies there. 4 new cases today, 3 each the 2 days before in the entire county. This has brought the 7-day average down to just over 5. I'll remind folks, we were at not very long ago, we were at our peak 7-day average of the entire pandemic in early April, when we were averaging over 70 cases in the county per week, and had one day where we were at, I think 106 was the high point. We are now in a very different place. And the wastewater, and I don't know if, Samantha, you want to well, I guess we can. Here's the infections, the latest case numbers. You can see that steep decline. And then why don't we pause there? We'll let Dr. Loeffler get in, and we have a couple more slides to look at, including the hospitalization slide, which also, as you know, paints a very positive picture. But Dr. Loeffler, I turn it over to you to give the public health perspective on what this all means.
Yeah, I mean, on the previous slide, I think that, Chittenden County and the state of Vermont has a lot to be proud of. I mean, leading the country really in getting our population vaccinated. That's great work by the state, our healthcare providers, the people administering the vaccines, but also everyone that made the effort to sign up and get vaccinated. There's a lot of encouraging things on there. Essentially, 95% of people over the age of 60, who are the people at highest risk for getting very sick from COVID, have been vaccinated. That's amazing. And you're seeing our 18 to 29-year-olds come up. It's over 50% now, just barely, crossing over 50. And I know there's going to be some pushes coming soon to make it more easy for that population to get vaccinated. Mayor, you and I talked last night about that's a busy group of people. A lot of them have young families, are working long hours. And so bringing the vaccine to them, I think, is going to really help us. I love seeing that our younger Vermonters, ages 12 and above, getting vaccinated very quickly at a high rate. So much to be proud of and optimistic in that data. And I think that, the trend that you showed in the last slide reflects that. We've seen the number of Vermonters being infected since mid-April as vaccines started to really pick up drastically drop off. Vaccinated people just really don't catch COVID, don't get sick, and don't end up in the hospital. And so I think these results exactly reflect our leadership in the country on getting vaccinated.
Let's flip, Samantha, to the next slide that I think does show, well, this is the wastewater testing, which, you really can see the dramatic trend there now of downward, dramatically reducing levels of the COVID RNA in our wastewater. That is across all three treatment plants. We're seeing that downward indication. And one of the things I like showing this as a separate from the infections and the hospitalizations, because this really shows us where those trends are headed. This, or at least gives us a good sense of that, in that the wastewater data tends to be a leading indicator of where the infections are going. So I think there's a lot of reason to be hopeful that the downward trend will be durable, at least through the coming days. And then finally, I think, do we have the hospitalization slide? I do find it really interesting to look at this slide juxtaposed with the infection slide a couple back. Maybe we can toggle back and forth in a moment, because what you can see here is you see the downward decline since April, which is it looks pretty similar, not quite as steep as the downward decline in infections. But what's really different about this graph is that there wasn't much of a peak in early April in hospitalizations the way there was with infections, which I think really validates the effectiveness of the strategy of getting out and getting the vaccines first to the older populations, the populations that are much more likely to become hospitalized and suffer serious consequences. That had already started to take hold by April, is the way I read this data. And maybe, Samantha, could you just toggle back to that so people can see that separate peak while, I don't know if you have anything else to add to that reflection, Dr. Loeffler.
I think you hit it spot on. This is clear, in my mind, evidence that shows that vaccines work. Vermont vaccinated older Vermonters first because they were at highest risk for bad consequences from the virus. And when those people were vaccinated, even though there was still a lot of infections in Vermont from people who hadn't been vaccinated yet, people weren't ending up in the hospital at the same rate. So I think it's clear proof of how well the vaccine works to prevent illness, but also to keep people who get COVID out of the hospital. Younger Vermonters in general have less risk. It's not no risk, but it's lower. The other thing I would add about the wastewater data, Mayor, is that that's, I would call on the ground proof of how little or how much virus is out there. Meaning we don't see everyone who has COVID in the ER, and thankfully not everyone who gets COVID ends up in the hospital. So seeing evidence in the wastewater that COVID rates are very low shows me that there's not a lot of COVID circulating in Chittenden County right now, in Burlington. That's very positive news.
It's really been interesting to see how that testing has been valuable in a variety of ways during the pandemic. It's one of the things we have funded for the next years to continue that testing. And maybe Brian Lowe who's really led that effort in a lot of ways, would like to say a little bit more about that when he comes on later. This could have broader applications beyond just the pandemic that we want to hold on to in the months and years to come. Dr. Loeffler, we're in such a hopeful and at the same time disorienting period in this pandemic. Guidance from the feds and from the CDC and the state has been changing quickly. We are in a period where everybody has to assess risk, throughout the pandemic, people have had to assess the risk for themselves and their loved ones. Clearly the risk is shifting as we get to this stage of the pandemic. What advice do you have for Chittenden County residents as they're thinking about their personal lives or maybe, as the head of a small business, as we, get into the latter parts of May and June here, given the data we've just looked at? How should people be thinking about risk right now? How do you think, should people be considering changing the behavior of the last 15 months, given where we are?
Mayor, if you remember, as the pandemic was ramping up, I think guidance was changing quickly and information was coming out and people were trying to understand, boy, what do I have to do to keep myself safe, my loved ones safe, my neighbors safe? And the information was changing around masking, social distancing, indoors and outdoors policy. There was a lot of change happening. And then we got into a steady state, which was not normal, but comfortable for people. People knew how to manage their risk and what they were comfortable doing. And there was very clear guidance. And I think this ramping down phase is going to be somewhat similar, meaning the science that we're getting is very encouraging and very positive. We know vaccines work. You've seen the CDC now say that it's appropriate. You don't have to wear masks in many situations, but not all. You've seen the state of Vermont say that. So the science is there, and helping people understand their personal risk, the social components of this, is going to take a little longer for different groups. And so what I would say for people is follow the science, follow the guidance from the state. But I'm not surprised at all that different areas, towns, and so on are having slightly different approaches as we wind it down. But I'm personally extremely confident that over the next 3 to 4 weeks, as we get even more Vermonters vaccinated, as the risk gets even lower, that you'll see many of the things that we love, many of the things that we have been so looking forward to for the past 15 months happening again. There's so much to be optimistic about right now and so much to be positive about. So I really, I'm thankful the science is coming out to support returning to what I consider, post-pandemic normal. And I'm also going to let people take the time, a little bit of time they need to get there. I think there's a social component to this that we have to understand. It's been a tough 15 months for a lot of people. And there's been a lot of fear, and there's been a lot of people who did a lot of stuff to made sacrifices to make sure that they and their loved ones were safe. And so I think we have to understand that and let people get there, but it won't be long. I'm confident of that.
Thank you for that, Dr. Loeffler. One more question from me, and it's sort of related. There has been a lot of discussion throughout the pandemic about the concept of herd immunity, and in recent weeks, certainly kind of at the national level, I've seen a variety of kind of new takes on what it means. Some people doubting that we're ever going to achieve herd immunity. Others kind of arguing, well, maybe, but herd immunity turns out not to be that important of a goal in the first place. What are your? Can you shed any light on this debate and this discussion? Because I do think there's some confusion about it out there.
Thanks for asking. And we've actually talked about herd immunity on these calls a number of times over the past 15 months. But we've also said, I personally think, and no one knows yet, I'll just say that, no one knows, that some amount of COVID and some version of COVID could be with us going forward. You have to remember that the huge risk of COVID-19 when it started, it was a new virus that our bodies hadn't seen before. And we were very, very concerned that this illness would overwhelm our healthcare systems and kill a lot of vulnerable people. It unfortunately has killed, around 600,000 Americans and about 250 or 60 Vermonters. So not insignificant and terrible for every person in their family who suffered that. As we've gotten people vaccinated, now it's not really a healthcare issue in terms of filling our hospitals as much anymore. With so many Vermonters vaccinated, the chance of the current COVID strain or viruses that are out there overwhelming our healthcare system, filling our ERs like it's happening in India right now, or overwhelming our ICUs is really resolved. Now it's a matter of figuring out how to deal with this thing in an ongoing fashion. Will we need a booster shot? What will happen in the fall if it comes back? What will happen if there's a new strain? Will I have to alter our patterns a little bit? We don't know yet. We haven't had this before. This is a once in a lifetime pandemic. About 100 years ago, a flu virus came around, the Spanish flu, and they didn't have all the information that we have now. And so here's what I know. I'm very confident in the vaccine's ability to protect us. I'm very confident now going forward that COVID will not be an issue that will overflow the hospitals, which we didn't know a year ago. We were very concerned about that, and not everyone will be able to get care. And I'm confident that we know that we have new vaccine technologies that can really quickly adapt if necessary. So I'd like to finish with is, I'm so proud of Vermont and Vermonters for their response in this pandemic. When you and I started talking about this February, I think it was of 20, I think, there was so much we didn't know about. There was so much we were asking of people to do. But based on the good work by the state of Vermont, our city and town governments, our health department, our providers, all Vermonters basically working together, we've got through this in the best in the nation in terms of saving Vermonters' lives, saving each other. We got it through without really overwhelming our healthcare system. We got through it with getting the best vaccination rate in the country, and I'm confident we'll catch up on the other areas. And that's going to get us back to the things we've all been dreaming about for 15 months. I can't wait to be out walking on Church Street. We were able to have a gathering at my house last Sunday where everyone was there. We were able to hug everyone in a good-sized gathering with every person vaccinated. So I'm so optimistic now, and I'm confident going forward that we'll be able to handle the challenges. And there's still probably some small challenges in front of us on this, but I think most people should be grateful, proud that they're Vermonters, proud they're here, and not too concerned about the future. We will get through this.
Dr. Loeffler, I'm feeling I'm a little overwhelmed with emotion just with your closure there. It has been such a journey. I remember so well that first town hall that we had together on a kind of dark winter Sunday afternoon. It literally, we were in the basement of City Hall. It really, I've lived in a city before where you felt a hurricane, where the hurricane was expected to hit shortly, and that just sort of uncertainty. That was the sensation I had back then. This storm was coming. We knew it was going to hit. We knew it was going to hit hard. We didn't know exactly what it was going to look like. Now here we are, 15 months later. The sun is shining through behind you. It's the beautiful Vermont spring and summer is arriving, and it really feels like we are coming out of this. Clearly, the worst of this is behind us, and hopefully, it will be fully behind us in just a matter of weeks. If we finish the job, make sure vaccines continue to be deployed to everyone who wants one. We're going to work very hard to essentially make it so that everyone wants one. We still have a little bit of work to do with some groups, although this is one of the areas that just Vermonters are doing so much better than by dramatic differences. There's so much less vaccine hesitancy here than there is in other parts of the country. So I think we're going to move on to that in a moment. But Dr. Loeffler, thank you for joining again. I'd like to have you back at least one more time to officially when the emergency is officially over. The governor has extended the emergency into June. We're reviewing the city when the city emergency will be lifted. And I declared that emergency the day after that town meeting last year. It's been such an experience. It's been a real privilege, Dr. Loeffler, to work with you throughout this. And I think the community is very fortunate to have had you in this leadership position. And you're one of the reasons why we are having this nation-leading response. So thank you.
Thank you so much.
Now I'm going to invite our Chief Innovation Officer and the leader of our COVID-19 municipal response, city response, Brian Lowe, to join and to discuss the local and statewide changes to various rules and the city's ongoing work to make the vaccine easily available. So Brian, first, and Brian is with us here, right?
Yes, you've got me here, Mayor.
Great. Thank you, Brian. So let's discuss the new changes to the public health guidance and how they came about and what folks need to know when they're visiting Burlington, specifically given where we stand. The CDC and the State Department of Health have ended the mask mandate for vaccinated people in Vermont, outdoors and inside in retail shops. And some other settings. The mandate remains in place for those who are unvaccinated. So there's, I think the first time, right, in this pandemic, both state and federal government have sort of different set of rules for people depending on their vaccination status. In Burlington, we had a discussion with the city council on Monday, and a decision is made to keep the mask mandate in city buildings and retail stores in place until it appears at least June 7th. We want to point out that some things about the new state guidance, and maybe I'll turn this over to you, Brian. You want to speak to the guidance and how people should be thinking about it?
Sure, I'm happy to, Mayor. Thank you. The new state guidance does require masking in certain areas and in certain lines of work. So, for example, in addition to the mask mandate remaining for folks who are not yet vaccinated, the mask mandate remains in childcare and school settings and in public transport settings. So that means buses or the airport here in the city. It also remains in healthcare settings and in long-term care facility settings. By the state rules, it allows businesses and individuals to kind of set their own standards. It does not prevent anyone from putting masking guidelines up in their business or for themselves. The key distinction that the mayor made that I want to make sure is clear is just that in Burlington specifically, the council has decided to postpone action on reviewing the city's local mask mandate, and that will stay in effect for city buildings and for retail in Burlington until at least June 7th.
So I know, in a lot of ways, this was a pretty sudden change in federal guidance. For others, I think that is clearly true. I think it's also true that some of the shift in guidance, maybe particularly for outdoor guidance, was sort of long overdue. There has been for a long time expert analysis of national and global data showing that disease transmission in outdoor spaces is very rare, and it's also very rare for there to be any transmission for fully vaccinated people. I thought the New York Times kind of summed it up well earlier this week when they said, kind of trying to give people some guidance. How do you think? How to think about the threat of COVID today? They said, vaccinated folks should think of COVID at this point as like the risk of a mild flu that you probably won't get. Again, that is for someone who is fully vaccinated, given that your chance of getting, if you're exposed in this increasingly less, at a time where there's very little virus circulating, if you're exposed, you have only maybe a 1 in 10 chance of the vaccine not working. If you really have a close contact, and then beyond that, there is just vanishingly small number of people who, after the vaccine, have had something serious happen to them, hospitalization or worse. So that's sort of the backdrop underlying why these changes came. Do you want to add anything to that, Brian, and maybe specifically talk about? I think this has been a kind of under appreciated point that this is public health guidance that was changing these rules for public health reasons. It was not merely a change intended to reflect the fact that the risk is much less and we can start to return to normal, but there is actually explicitly a public health benefit to changing the rules that the CDC perceives and that others have found. Can you speak to that?
Sure, I can speak to that briefly. Thank you, Mayor. I think, and it's really important because it's influencing how on the city team we're really trying to keep the emphasis on making vaccinations as accessible as possible. Like you and Dr. Leffler emphasized earlier in the briefing, these vaccines work. They're free. They're extraordinarily effective, and so the CDC, in the explanation of why they created this distinction between folks who are vaccinated and folks who are not vaccinated, pointed to polling data that they have about people's likelihood to get vaccinated. And there are a number of incentives for people who are on the fence about vaccination. And one of those incentives is, if I don't have to wear a mask anymore, 48% of respondents to this significant poll the CDC referenced, a Harris poll, indicated that the ability to get rid of their mask was something that would incentivize them to consider vaccination. There are other factors, the removal of, for example, quarantine and travel requirements, or testing requirements rather, when you travel, is cited as another reason why people who are on the fence about this might be willing to get vaccinated. And I know the state removed those requirements relatively recently as well. But I think what these studies point to is that given the incredible effectiveness of these vaccines, anything that we can be doing as a community to make vaccines more accessible and more attractive is something that has a pretty high value.
So let's talk a little bit more about that group of unvaccinated people and what we're doing to address their concerns. And it really is interesting to see that there's increasing data coming out about why people remain unvaccinated. And it is far from a monolithic group. There are kind of some recent journalism that's been really effective, saying there's sort of four main groups that people break down into. Some are skeptics about the seriousness of this disease or very distrustful of the system. In Vermont, at least the New York Times reports that the larger group they are either watchful, they're waiting to see what happens next, they're not quite ready to take the step themselves, or they just was defined as sort of cost anxious. They want the vaccine but haven't been able to kind of afford the time or the perceived cost, even though hopefully everyone, not everyone understands that that this is a free vaccine. So this next strategy, these pop-up clinics, I think really speak to those last two groups, Brian, that people who maybe have kind of essentially been on the fence. They're not philosophically opposed. They're not deeply skeptical, deeply opposed to getting the vaccine. They just haven't, for one reason or another, yet. This new vaccine strategy is really designed to speak to them. Can you describe it a little bit and give some of the details behind that?
Sure, I'm happy to speak to this, and I want to really credit our state partners for helping organize this, and a number of different partners in the community have stepped forward. CHCB and the Pride Center, and then a number of folks that we had on the briefing just recently. The Vermont Health Equity Initiative continues to make vaccines much more accessible in a completely different and very, I think, inviting climate. So on Thursday and Friday this week, sorry, Samantha, do you mind going back one? We've got two clinics, or really three, two at North Beach, Thursday and Friday. This is a place that has high traffic. I'm hoping the weather is really good on Thursday and Friday. It'll bring a lot of people down to the beach. The state and Walgreens, the city and others will be there with Johnson & Johnson vaccine to allow people to walk right on up and get a vaccination if they want to, somewhat spontaneously. The Pride Center and CHCB are doing one on Friday afternoon as well in the Old North End from 2 to 5 on Winooski Ave. And then on Saturday, there's two more, one on Church Street Marketplace that's in the evening, 6 to 10, and one in the afternoon, I believe, on Saturday with the Vermont Health Equity Initiative. The one on Church Street Marketplace is done in partnership with Garnet, which is really a company that started much smaller at the beginning of the pandemic and has grown by leaps and bounds and has been incredibly helpful in a variety of ways with testing and vaccine access. So these different pop-up sites are intended to make the vaccine more accessible if you have to work during certain times. Maybe it's easier to get there in the evening. If you're going to be out and about anyway, it might be something you would take somewhat spontaneously. And then it's also done in a way to try and bring you to a setting where you are comfortable with people either through the Vermont Health Equity Initiative or through the Pride Center and outright. So there's a lot afoot, Mare, and I know there's others that I haven't listed here, but lots of different clinics happening over the next couple of days and weeks.
Great. Can you speak? So we just put out a lot of information about these clinics this week. Is this something you expect to continue into future weeks, or is that still kind of being nailed down?
It's still a little bit in the air, only in the sense of some of these clinics will continue. The Vermont Health Equity Initiative clinics are continuing through July, I believe. There's others that are run by AALV, the Association of Africans Living in Vermont, in both Winooski and Burlington, that are continuing. But like the North Beach ones, I think we need to see what the response is like. Does it work? Are we actually able to bring people in? Are people willing to engage? If not, what's the next iteration that we need to try? And I put Church Street Marketplace in that same category of, I'm optimistic that it should work. We're trying to bring it down to a time and place on Church Street that's very busy and see what the uptake is.
And I think with all of these, with the Church Street and the North Beach, and sorry if I'm repeating what you just said, but it's there in the graphic. Just you want to make sure it's emphasized. Another kind of nod to ease and kind of convenience and accessibility that will be a feature of this next strategy is a focus on the the use of the Johnson & Johnson one and done vaccine, which really reduces the complexity and the cost and time that individuals need to invest to get fully vaccinated.
That is certainly true, Mayor, for the tertiary marketplace in North Beach. The Vermont Health Equity Initiative is Pfizer, so it is a 2-dose sequence, and I do not know which vaccine they're using at the Pride Center.
All right, very good, Brian. That why don't you stick around in case there are questions? That basically concludes our COVID briefing for today. Before we go to questions, we have another major announcement to make, and I'm pleased to welcome on another panelist here. I'm looking to see, and there he is. I am so excited to announce that Brian Pine, I am appointing to be Burlington's next CEDO director. I will be bringing him forward to the City Council for confirmation next Monday. It is my hope and expectation that he will be confirmed and will serve, become another in a long line of great CEDO directors that we've been fortunate to have. Brian, let me say just a little bit about him, then I'm going to hand it over to Brian to share a few more words. I believe Brian is uniquely qualified to lead CEDO at this moment. He he worked in the department for 18 years. He knows this community extraordinarily well, having served in a variety of roles, both professional and community roles, everything from leading the Old North End, really essentially starting the Center City Little League, to being a key part of the pandemic response in the early days of COVID, when he helped set up a facility to serve the most vulnerable and create an isolation site. He has the opportunity he will have the opportunity to lead a department that is coming out of the pandemic invigorated and changed and being deployed to new initiatives. And he also someone who has shown, demonstrated, I think, over a long period of time, a deep commitment to the key challenges that the city and the CEDO face right now, whether that's racial justice, whether that's housing, whether that's working with our refugee and immigrant communities and implementing our new language access plan, or dealing with our very serious challenge with people experiencing homelessness. And I'll add to that list our new revitalized efforts to work with the senior community is also something that Brian has direct experience on. I felt urgency to make this appointment. We have a big job in the immediate months ahead, working with the community and figuring out how to deploy these once-in-a-lifetime American Rescue Plan Act funds. And I'm very excited about Brian kind of dipping into some of his past community engagement efforts and helping to lead that effort. Just a few minutes ago, introduced him to the CEDO team, which has, in addition to all these sort of exciting things that have been happening recently and during the pandemic, has also has experienced significant turnover in recent years, and is they had communicated to me that having someone who really understood CEDO, understood both where the organization has been and where it needs to head to succeed was critical. And I'm confident that we have found that person in Brian Pine, and I got a very positive reception from the CEDO team on that front as well. So with that, Brian, thank you for stepping up and serving this way. It's exciting to have you on the cusp of joining the team.
Thank you, Mr. Mayor. I really appreciate your support, your confidence in appointing me to this position. I would just say that my love for Burlington made this decision pretty easy when the mayor asked if I would consider taking on this position. I even have my CEDO team hat to show that my support for the team is 30 years old and continues to be just as strong. From a different era.
I think that's a Weinberger era Cito cap, though, isn't it? Or does that predate?
That goes back. I could talk about who designed that one. It was supposed to be a logo that was a temporary logo that Richard Donnelly created in the mid 2000s. So
I'm embarrassed to not know that. That's another example of why it's going to be so awesome to have you on the team, filling in my gaps in Burlington history. I thought we had done something new there, and glad to be corrected.
Yeah, well, I'm excited, really excited to be rejoining the Cito team. For me, serving the community that has been my home for the last 40 years is an honor that is an emotional honor. I don't want to go too deep into it because we may diverge off into a different path, but there's really no higher calling than public service in my life in terms of making a positive difference in the community and in the lives of people who live in our community. I really look forward to joining the mayor and his team with that goal in mind. And I'm really grateful for the opportunity to rejoin the Cito team in support of the mission, which is to engage the community in finding solutions, developing ideas to achieve our collective vision for an equitable, safe, and really inclusive city with real meaningful opportunities for everyone. It was actually 25 years ago, right about now, that I was in the process of going through the hiring to join Cito. It was June of 1996. And I was hired to be the coordinator for the Old North End Enterprise Community, which was an effort the federal government initiated. And in Burlington, we chose to focus on the downtown, the waterfront, and the Old North End. And bringing the community together was Cito's job. And the work that Cito did and this community did in developing that plan for the enterprise community was really a pretty awesome transformative process that served to really tie people together. And it included over 50 community events where everyday citizens came forward and said, if you get federal money, here's how we'd like you to spend it. And the promise of additional resources and some federal preference from the federal government made people interested. They paid attention. We ended up getting the $3 million. It wasn't a lot of money, but it leveraged another $23 million. In the end, we had nearly $30 million of new investments that were made as a result of that. So it was a pretty transformative time, really inspiring. And when we finally submitted our plan to HUD, the HUD secretary said, you have 70 strategies here for the economic, physical, and social development of your city. I'm not really sure how you were able to do that in such a short amount of time. And the answer that was given was that Burlington, if we put our minds to it, can accomplish amazing things. Truly transformative work can happen in this community. And I believe we're at that inflection point right now with COVID and with coming out of the pandemic. And this model that the enterprise community provides for us is really, I think, a great blueprint for how we can convene and connect the members of the community to develop a shared vision and creating a plan for allocating the ARPA funds, those that we will have sort of flexibility or discretion over. So I just want to note that and say that I'm really optimistic about that. And I think it's important to touch on a couple priorities that the mayor and I have discussed so that the community knows what we're focused on in my role as Cito director. We really have internal operations that require the attention of the director, and that is implementing the strategic plan that was developed in 2019 and really carrying through some of that work. And it sounds rather dull and bureaucratic, but it's what's needed to build staff morale and really ensure that our impact is as meaningful and as lasting as it possibly can be. We also need to always ensure that our funding and our finances are in sound condition and that we're adequately funded to do the work this community expects. I'll never forget Neil Lunderville saying, the community's aspirations for Cito are so great, but the resources Cito has available are not nearly enough for what the community expects and really kind of is demanding of Cito. So I just want to point that out, that we're going to focus on that as well. The mayor has a housing summit planned this summer, and that will have an emphasis on closing the BIPOC homeownership gap. And I believe that's a responsibility that we have and we have to take very seriously, especially the Black homeownership gap that is acutely below what other segments of the population currently enjoy for homeownership rates. We have hundreds of people who were experiencing homelessness and because of COVID resources have been housed. And there's the eventual returning of those folks to the community from hotels and motels that we as a community are going to need to grapple with and really focus a bit like a laser beam on that issue, because it's potentially, I think, an opportunity to ensure that we don't have hundreds of people returning to homelessness. And that was going to require lots of support from our state and federal partners. We obviously have the opportunity now to expand significantly the supply of permanently affordable homes for both renters and homeowners. And that's a priority that the mayor and I share. Economic and community recovery with a real focus and a racial and economic justice focus, I think is something that the mayor and the city council is fully behind. And I'm excited to work with them on that. We also are going to focus on supporting existing and aspiring small and micro businesses as a core part of both a durable economy and really to ensure that we recover in a way that brings everybody along and doesn't leave anyone behind. We have an opportunity as well with our focus on our net zero energy plan, to harness the clean energy economy to create decent paying jobs for low income and working class residents through a really focused workforce development initiative, and that we are essentially a city of neighborhoods, and that CEDO has often been that glue that convenes and connects our people to build stronger neighborhoods and create more inclusive community. And that is what really excites me about this opportunity. So thank you, Mr. Mayor. Thanks to the voters of Ward 3 who have given me the chance to serve at two different time periods in my life, this community, as we strive to be the best and most just little city in America. And I appreciate the mayor's support and look forward to working with the mayor's team, the city council, the CEDO staff, and the entire community.
Thank you, Brian. Thank you for sharing all that. And your point, your thanks to the people of Ward 3 at the end just brings me to the last piece of news I think we'll share here is if per our charter, if and when Brian is confirmed by the city council, he will need to leave the council, resign that spot, and the expectation is that if that happens, I will quickly then call a special election per our charter for the voters of Ward 3, and that election would take place will take place within 90 days of the vacancy, which means that the plan currently, again, this wouldn't be official until all these steps happen, but it would probably be an election on August 17th, which is the Tuesday before the end of that 90-day window. And we certainly encourage Ward 3 residents to who are interested in serving this way to think about running and to think about serving in this way. It's certainly an opportunity that is coming up. So with that, Samantha, are there any questions for us?
There certainly are. The first question is from Courtney Lambden. 1 second while I find Courtney. Okay, Courtney, your mic is enabled and go ahead.
Okay, can everyone hear me?
Can, go ahead.
Perfect. Okay, so just to clarify, Brian, you are still a city councilor until and if the council votes to confirm this post, right? And that is potentially this Monday, Mayor, May 24th?
Correct. I have, this is not a surprise to the councilors that this announcement's being made today. I've been in consultation with President Tracy, and he is aware that that this is coming for Monday's agenda. And I'm, I've also talked with President Tracy, and I believe Councilor Pine has talked to all city councilors, and I believe there's strong support for this confirmation on the council, is my sense.
Great. And Brian, maybe can you talk a little bit about, leaving your role as a councilor and how, you've been a member of the Progressive Party for a long, long time, and any thoughts about how the balance of the council could change with you leaving? Maybe we'll start there.
Sure. The I think it's fair to say that the balance of the council is one that is going to be decided by the people of Ward 3. So this seat will get decided in that special election in August. And I'll be honest, since 1981, progressives have won elections in this ward without a break. So it's been 40 years that progressives have won the seat in this ward. I think that the message that is for today is to focus on what we share in common. And the mayor and I share a commitment to ensuring that we come out of this recovery in a way that builds a stronger economy that serves people who are probably harmed the most by the pandemic. And so as far as working across the aisle, I personally have always felt that I am first and foremost dedicated to and committed to Burlington and Burlingtonians and what's best for Burlington. And so the political differences are something that we debate, and we sort of battle that out at election time and at the ballot box, and then we take the results and we work together as best we can for our community. And that's what we're preparing to do.
Great. I'm guessing that's kind of the answer to the question I was going to ask, which is obviously you threw your name in the ring to run for mayor and potentially unseat your now boss. So I think that's just something we have to acknowledge. Brian, I didn't know if you want to just kind of continue on what you were saying before and respond to that. And I don't know if the mayor has a comment as well.
I would just say that my decision over the last few weeks in discussing this opportunity with the mayor is based on, first and foremost, my love for this community and my desire to do what is in service to Burlington. And the mayor and I share that. We both share a deep and abiding love for Burlington and making Burlington the best small city in America. And we might not always have 100% agreement. And I'll be honest, I don't have 100% agreement with my own spouse, but we've been together for over 35 years. So, there's definitely room for respectful disagreement, and there will be in our relationship, and there will continue to be. But productive working relationship. I've always had a productive working relationship with Mayor Weinberger, and that will continue.
Great, thanks. And then just one more, unless the mayor had anything to add on that. My last question. Do you? Sorry, on a roll now.
I do. I think I would like to say that first and foremost, I'm making this decision, making this announcement because I believe Brian is the right person to lead CEDO right now. That's what this decision is about. I think he brings a set of unique strengths and experiences that I tried to articulate, and that I think we urgently need his that perspective, that experience in the challenges that we face in this critical period ahead. I do think that this is what has happened. To me, this represents what Burlington politics should be and is often about. We do have partisan, contested, toughly fought elections, and then we make a decision as a community, and we people who had been competitors or on other sides of a campaign roll up their sleeves, get down to work, and make the community better for Burlingtonians. And I've seen that happen many times in my 9 years. I'm totally confident that's Brian and I are going to be able to work together in that way. We work together in that way even when we were both candidates for this term. I'm confident we'll work great together going forward. I've had Brian on the city team before, and it was a very positive experience. I think it's going to be even more exciting to have him in this more senior leadership position. And again, I do think this creates a new opportunity for the people of Ward 3, for people who are looking to get involved in a new way, and encourage them to consider running.
Great. Actually, I'm going to leave it there. Thank you both so much.
Okay. Thank you, Courtney.
Okay, next we have Pat Bradley. 1 second, Pat, I'll find you. Okay, go ahead, Pat.
Hi, quick question on if you have to have the special election, and Brian, if you are appointed, your appointment is approved this coming Monday, does this mean that the seat is going to be empty for a couple of months? Completely empty? You're not going to be serving on it at all? Your appointment takes effect basically next Tuesday if the appointment is approved?
Yeah,
Yes,
that's right. That's right, Pat. I've talked to the city attorney about this. That is the right way to read the charter. Brian, in fact, would leave the council as soon as he is approved, even mid-meeting if it comes out that way. And there will be a vacancy in the seat, and that's the way our system works.
Okay. And Brian, you've had a lot of different topics that you've been working on the city council. What sorts of topics do you think you can carry forward from your work on the council at CEDO and vice versa? I mean, you've got experience basically on both. I mean, what will mesh well and what can you carry forward here?
Sure. Thanks, Pat. The work that I outlined in my comments are really the items that I think we're going to focus on, which is internal operations, housing broadly, a just recovery in terms of the economy, connecting the need to move towards clean energy as a workforce development strategy, bringing a real racial and economic justice focus to our work, rebuilding, if you will, or sort of revitalizing the focus on the neighborhoods throughout the city. Those are things that the council is fully behind, and the mayor is as well, and will just continue to be the priority work of CEDO as the way we were established by the voters of Burlington when we were added to the charter. And there will be things that will come up that we haven't envisioned today because that's the nature of this work, but that CEDO's role as a way to ensure that federal resources are allocated and distributed in a way that is open, transparent, and has the most lasting, meaningful impact on the community is something that I have a lot of experience with and believe it's a need that we have right now that needs to be addressed as we come out of the recovery.
Thank you, Brian. Thank you, Mayor.
Thank you, Pat.
Thank you, Pat. The next question we have is from Grace at VT Digger. Go ahead, Grace.
Hi, can you hear me?
Ken, go ahead.
Great. So I just wanted to reference the amount of turnover that CEDO has seen in the past couple of years, which you had brought up, Mayor Weinberger. My first question for you, Brian, just to put it bluntly, are you intending to remain in this role for the long haul?
My plan is to serve in this role for as long as the mayor feels it's the right fit, and I believe so. My plan is to stay in this role.
Gotcha. Do you feel like the history of turnover in CEDO's leadership has negatively affected it over the past couple of years?
I think that staff do amazing work in CEDO as well as throughout city government. I have always admired and been impressed with the work that people do, really from everything from frontline workers who maintain and fix our streets and our electric utility service, and really everything about city staff is something that I think a lot of people either take for granted or they're not aware of, or maybe they have misperceptions. But I am always amazed by the way CEDO staff rally, regardless of the challenge, regardless of the resources available. CEDO staff will step up and try to deliver for this community every single time. And that's been inspiring to me. And I look forward to working with that kind of team again.
Thanks for that. I don't think it answered my question. Do you feel like CEDO has been negatively affected by the turnover in leadership over the past couple of years?
I don't know. I mean, I'd say the performance has been, given that the resource recovery effort of the city has been pretty exceptional, I think, in many ways, and CEDO is a big part of that. So I would say the evidence doesn't suggest. The performance of CETO has been excellent through the recovery or through the pandemic, and so the results do not support the supposition that staff has suffered. I would say that staff have shared with me that they're looking forward to having sort of stable leadership that is experienced, and I hope to be able to bring that.
You had referenced something Neil Lunderville had said, I think a few years prior, that CETO might not have enough resources to complete all of the projects that Burlington wants it to get to. Beyond just beefing up CETO's resources, is there anything else that you feel like the city of Burlington should do to make this office successful under your leadership moving forward?
Well, there's a phrase that I think is important to use, even though it's not always the one that people want to hear, but it's managing expectations. And I think the expectations for CETO ought to be high, but I think we ought to be honest with ourselves as well about what we can in fact achieve given the demands that we have on our staff. So I want to be, and I will always try and be as candid as possible about what we have the capacity to undertake and what we don't. And the elected leaders get to decide what our priorities are, and that's the mayor and the city council. And then we carry out the work in partnership with our community. But the resource issue has been an issue CETO has faced for many, many years. That's not new, and that did not start with this mayor, and it certainly probably won't end with this mayor, because it's always been a challenge for CETO is having adequate resources, especially since the federal government retreated from supporting offices like CETO across the country with the infusion of new federal resources. We hope that that's the beginning of a return to federal commitment to cities. Our hope is that will be the case. And with this administration so far, it seems as though there'll be much more support from municipal government. And that would help CETO quite a bit carry out what the community is looking for.
Gotcha. Thank you.
I will just share with the media, we, as a result of that turnover, we recently had a kind of fun, a little bit exciting experience when we got on the phone with the Biden White House the day they announced, I think it was May 10th, the new regulations for there's additional interim guidance released regarding how ARPA funds can be used. I wasn't on the call myself, but members of the team were, and the person greeting mayors and cities from across the country to that call was Luke McGowan. We are excited about the role he has, and we are actively working with him. I've talked with him a number of times in the new role, and think that him being there is going to be helpful to Burlington in the years ahead, as much as it is challenging to deal with leadership change. So just thought I'd share that little anecdote. Do we have anyone else, Samantha? Or were you done, Grace, or did you have more?
I'm all set. Thank you.
Great.
Oh, sorry. I didn't realize I was unmuted. That was our last question.
Okay, very good. Well, thank you again, Brian, for making the decision to serve the community in this new way. Very excited for the next steps. Look forward to the confirmation vote on Monday. Thank you for everyone for joining us today. I see it's been kind of fun to look and see who is participating today. Many old friends of the city and CETO have joined us for this significant moment. If we can't quite be together in person for significant milestones like this, this is the best pandemic thing. We are looking forward to having events again in person very soon. I've started conversations with President Tracy about when public meetings will begin again. So more to come for future briefings. Hope you'll join us again sometime soon. Thank you, Brian, and good luck.
Thank you. Have a good day, everyone.